So check this out, guys. This is really a fascinating type of rotator cuff pathology that we're seeing here. So we've already looked on the undersurface, and her articular side of the rotator cuff is absolutely pristine. It's perfect. Yet she's had this pain for 6 to 8 months. We've given her injections and physical therapy. And check this out. Here's the back half of the CA ligament right here. And you can see there's significant abrasion on the back half of that ligament. And then as I scroll in here, you can see, look at the high-grade partial tear of the rotator cuff. This is on the bursal side. You can see as you sort of roll in here, every time she's moving her arm like this creates a significant pain syndrome. So, what are your treatment options for this? Well, prior to the use of the Regeneten patch, I would have maybe debrided this, but then she misses half of her rotator cuff and she still has a source of pain and discomfort. So what we're going to do is just remove all this scar tissue here. We're going to just brush this up slightly, and I'm going to put the Regeneten patch right over top. And this patient, believe it or not, typically comes in at 2 weeks after surgery and literally can already tell me she feels better than before surgery. So Regeneten patch, bovine bioinductive implant. It's a super cool new way to really dramatically improve your pain and function. In addition, we're using an Exparel scalene block on this patient, which is also amazing. She's going to get 5 days worth of relief of analgesic pain associated with the block. This woman will not take a single post-operative narcotic pill post-operatively. She'll have near full range of motion in 2 to 3 weeks. She's out of a sling in 2 to 3 days and probably will not require physical therapy. This is a remarkable transition compared to what we were doing previously. So peace out. So at this point, guys, you can see here we've actually done the debridement. And I want you to see here, as I move this back and forth, I've released the CA ligament, I've debrided this slightly, and all that impingement effect is gone, but you still have this 50% or so partial thickness tear of the rotator cuff. And that's what we're going to fix next, so I'll do a little clip here in a second. All right. Go. Okay, so awesome. So check this out, guys. We saw the before, and you saw how we debrided everything. And now here's the Regeneten patch laying over top of that high-grade partial tear of the rotator cuff. And look how sweet this is. So that impingement or pinching sensation she was having is going to be gone immediately. And I think that's a big reason why these patients get immediate pain relief. You can also see how visually appealing this is when this patch or implant goes over top of the pathology. So this is a collagen-based implant that basically comes from the Achilles tendon of a cow. It gets purified, and then it gets placed into this type of a scaffold. And within 12 to 14 days, this is already cooking. We're already getting incorporation of this implant into the tendon itself. And then over time, if you come back in and take a second look at 3 months, 6 months, and 12 months, the patch goes away and it gets incorporated into the tendon. So it's really amazing biologic healing that's happening here, and we're seeing really terrific results. Thank you.